And hello, it is noon on Friday, and that means it is time for our Lunch and Learn. Now today, we're going to be talking about a subject that is near and dear to my heart because almost everybody that comes to see me because they are dealing with pain. And one of the things that we want to try and do is get you out of pain. Nobody wants to be in pain. I certainly don't want to be in pain. However, some of the traditional things that we do may lead to chronic pain. So we want to discuss this. We want to have a conversation about this so that you can make your best choices. And we want you to not have any pain. We want you to be able to heal and restore and repair very quickly. So most of the time when we hurt ourselves, whether we have a sprain or a strain, or we get, bumped around or whatever, a lot of the times that the doctors will recommend non-steroidal anti-inflammatory drugs or NSAIDs. I could have said NSAIDs, but then I couldn't remember what all it was. And it's all this big word. So I just thought I'd read that to you. So when they're giving you these anti-inflammatories, it does lessen the pain and we do feel better. Why is that? Because pain is an inflammatory response. And so we need to talk about why that happens, what we can do to facilitate that rather than to stop it, because we want the inflammation to do what it is supposed to do and not harm us in the long run. Short-term relief can equal long-term chronic pain, and that is not something that anybody wants. So pain from surgery, minor surgery, or a sprained ankle may need a small amount of an NSAID just to get you through the night or whatever. Long-term use is what we're talking about. So the guy says, and this is Jeffrey Mogul, who is a neuroscientist at McGill University, says that standard medical care of this type, prescribing NSAIDs for pain, is probably making the matter worse. The research suggests that this is not our best option. So what triggers inflammation and what is inflammation? In a study published in Science Transitional Medicine focused on 98 people with lower back pain. During that time, half of the volunteers 98 patients over 3 months. During that time, half of the volunteers fully recovered, while the other half developed chronic lower back pain. Using the RNA sequencing, the researchers compared the activity levels of the immune cells between both groups. Now, they discovered that neutrophils, which are immune cells that feature predominantly at the onset of an inflammation sequence, play a role in remaining pain-free. So let me just tell you about neutrophils if you don't know. So when you go and get your blood work, depending on who does your blood work, if I do your blood work, I'm always going to have a CBC plus differential. Now, the differential takes the white blood cells and breaks them down into 4 or 5 different subcategories. One of those categories is neutrophils. If you go to a physician that does not break down your white blood count, then I think you're getting a disservice, because it is looking at the different types of white blood cells gives us an indication of what's going on in your body. So when you do white blood cells, right, and you do the differentiation, then you have neutrophils, lymphocytes, monocytes, eosinophils, basophils. Now, you can also have meliocytes. Those are all big words, okay? You only get that kind of breakdown if they're looking at cancer or if they're looking at autoimmune disease. But most of the time, if you do a CBC with differential, you're going to break those white blood cells down into those different 5 different sets. Well, the neutrophils are the ones that rush to the site of the inflammation and begin to, they're the first responders, as it were, and they open up the pathway for blood and oxygen and nutrients and all that kind of thing to come in so that you can start and having repair in that tissue. So they help fight infection, because why? They're white blood cells, and that's what white blood cells do. And they repair tissue damage. So if you have damaged tissue and you don't have neutrophilic activity, then you're not going to have, cleanup on aisle 4. And that's what we all want, because if we don't have cleanup on aisle 4, then we've got damaged cells, and damaged cells create further problems down the road. This is why we have neutrophilic activity in our body, so that we can do what we need to do. So according to these researchers, those in chronic pain group started with less inflammatory neutrophil activity and later had little or no activity in those cells that create inflammation. In contrast, the genes of the recovered patients were very, very active in inflammation-related cells. So this could be a gene defect, because remember, they are looking at the RNA sequencing of the gene. So this might be something that we're born with. This might be something that we can take certain supplements to help mitigate that. The research doesn't show that they even looked at any of those options, but both of those options could possibly work. So neutrophils are the first responders that come in when we have an accident or pain or surgery or whatever. Scientists have long known that anti-inflammatory drugs inhibit neutrophilic activity in both people and in animals. However, the link to chronic pain has been missed because they only just looked at, oh, we have an injury, oh, we've had a surgery, oh, we're going to give this pain pill, and, the pain is resolved in a day or two, and then off they go, and they haven't up until now researched what's going on long term. So we want to look at long term. Eugene Aiello, who is a chiropractic physician and neurological researcher, he says that NSAIDs definitely interfere with the process. But not everybody in the chronic pain group was taking NSAIDs. More studies are needed to figure out what's actually going on with that. So there are generally two types of inflammation. There is acute inflammation, and then there is chronic inflammation. Now, acute inflammation is the good kind. So what is acute inflammation? Acute inflammation is I go out to eat and I eat something that doesn't agree with me. And so my body wants to get rid of that poison. So my body's going to either cause me to be nauseated or cause me to have all kinds of tummy trouble. Why is that? Because it is an inflammatory process to get whatever is offending me out of the body so that my body can do what it needs to do. That is a good inflammation. When we catch a bug, when we catch a virus, we get a fever. That is an inflammatory process. That is a good inflammatory process, because what that does is we get a fever, we get hot, the heat burns up the bacteria, burns up the virus. If we don't take a drug of some kind to bring the fever down. Now, of course, we do not want to have 104 fever or even higher than that. So let's be smart about this. But, 99, 100, 101, 102, 103, those are not high fevers that are going to have you go into a seizure or have you go into any kind of stroke or anything like that. So we want to let the fever do its work. It is a good inflammatory process. And when we stop that, especially young moms, when their baby is teething and whatnot, and they've got that fever, they immediately go to whatever they go to get the fever down. You're not doing your child a service. Every time we mount an inflammatory response, we are strengthening the immune system for the next bigger challenge. So we always want to do that. And there's a difference between strengthening the immune system and boosting the immune system. And so I want to explain a little bit about that. When your immune system is strong, you are eating well, you're taking vitamins, you're sleeping well, all those kind of things, so that your body can do what your body needs to do. If you have long-term inflammation, that is deleterious to the body. The body is not meant to handle that. And so we want to talk a little bit about that. Chronic inflammation leads to metabolic dysfunction. So what does that look like? That looks like diabetes. That looks like high blood pressure. That looks like obesity. That looks like arthritis. That looks like aches and pains, joint pains, all that kind of stuff. It looks like chronic fatigue syndrome. It looks like lupus. It looks like just about any kind of dysfunction is based on chronic inflammation. And so we don't want to have chronic inflammation. Acute inflammation is okay. Let the body do its work so that you can be healthy. If it's something that lasts more than 2 or 3 days, And really, chronic inflammation is something that lasts more than 3 or 4 months, okay? So we don't want to do that. We want to make sure that that is resolved. And normally, what I'm finding here in the clinic, what causes inflammation is poor digestion and poor nutrition. Now, you guys that know and watch all the time, you know that we have this wonderful little scanner here, Pharmanex PS3 scanner. And what this does is it reads the carotenoids in the heel of your hand, and it tells you if you're absorbing your nutrition. So if you're taking vitamins and the vitamins are not being well absorbed, then you are going to be in a malnourished state because you're not getting all that you need from your food. I don't care where you buy your food. I don't care how organic your food is. The testing is showing that the food does not have the nutritional density that it used to have. And so we need to take vitamins. All of us need to take vitamins. The older we are, the more we need to take vitamins because we just have a greater demand on nutrition because we are combating the aging process, which, you know, some people have the idea that you get older and you are more susceptible to sickness and disease. And I think that that can be your truth, but I don't think it has to be your truth. I don't have any sickness. I don't have any disease. I don't have any drugs. My blood labs, very good. My blood pressure is fine. My blood sugar is fine. All those things are fine because I pay attention to the nutritional aspect. I eat well, I rest well, and I take really good vitamins that are guaranteed to be absorbed. And the scan on the scanner proves that that does that. So those are really, really important. Because of that, I don't have long-term or chronic inflammation. Because I don't have chronic inflammation, I don't have any sickness and disease. So that's what we want. So what we don't want to do is go to the doctor and the doctor says, oh, you've got XYZ symptoms, which is XYZ disease, which leads you to XYZ pharmaceuticals. That's not what we want. We want to hear, oh, you've got XYZ symptoms, which leads to XYZ disease, but let's find out what is the cause of the inflammation. Let's find out what is the cause of the problem so that we can nip the cause in the bud, and then the body can take over and the body can do whatever it needs to do, because that's how we stay healthy and that's how we stop the chronic inflammatory process. So one of the first signs that we are inflamed is swelling. Now, why is that? Because swelling increases the surface area, which allows all of the nutrients, all of the oxygen, all of the different fluids in the body to rush to that area with the neutrophils to start the cleanup process. And so, again, we don't necessarily want to stop the swelling. Nobody wants to be swollen. I get that. Nobody wants that. However, if you have an injury and swelling, that is the first responders' way of getting more of the first aid to the place. Think about a bee sting, right? You get a bee sting, the place is going to swell, it's going to turn red, it's going to get hot. Why? Because that is the inflammation process, and that's bringing everything into that area. So that is the way the body deals with inflammatory processes. We don't want that for sure, but we need to let it do its work so that it can do what it needs to do. So Brendan LaGracia is a licensed acupuncturist and a nationally certified practitioner of Oriental medicine. And he says swelling is the body's innate wisdom to increase the surface area so that the healing mediators can then come into that area. So the neutrophils also clean up the tissue debris through lymphatic drainage. Now, you may not know what lymphatic drainage is, so I'm going to give you a little bit of an anatomy lesson here because that's just what we do, right? And so you've got lymph nodes right here in your neck. You might remember being little and you would say to your mom, oh, Mom, my throat hurts, and she would kind of palpate here, and you'd go, Mom, that hurts. That's really tender. Well, that's because you've got lymph nodes there. You've got lymph nodes down your spine. You've got lymph nodes in your armpits. You've got lymph nodes in your groin, and you also have them behind your knee. Now, you've got lymphatic fluid that passes through all of the tissues in your body, goes to the lymph nodes. Inside the lymph nodes are macrophages and phagocytes, right? Those are really cool names. Those are little Pac-Man-like creatures that eat up all the viruses, bacteria, any kind of poison that you have in your body. So whenever you have an injury, when you have inflammation, when you have swelling, the neutrophils go in, they bring all of the things that need to come in, and then they pull all the tissue damage, and they travel the pathway of the lymphatic drainage. So you have two circulatory systems. You've got your blood system, which all of us are well aware of because we talk about that. You can look at your wrist. You can see the red, well, not red lines, but blue lines. If you have red lines, you're in trouble, so don't have red lines. But you can see the blue lines in the underside of your wrist that you can see where your blood vessels are. Your lymphatic vessels are much, much smaller. You cannot see them with the naked eye, but they carry fluid, as I just explained. And if you took all of your lymphatic vessels and you lined them up end to end, I think they would circle the world, the earth, 5 times. Okay? So that's a lot of lymphatic vessels. But just like your heart pumps your blood, you don't have to think about pumping your blood because your heart's going to do that for you, because if it stops, you die, right? In your lymphatic system, you don't have a heart. You don't have a pump. What pumps your lymphatic system is exercise. You move your long bones, you pump your arms, and you march with your feet. When you do that, you pump the lymphatics, and the fluid does what it needs to do, deposits the poison in the lymph nodes wherever they are in the body, and then is recirculated and keeps doing what it needs to do. So if your lymph gets sluggish, if your lymph gets dirty, right? What causes that? Not going to the bathroom like you're supposed to every day. Not having your liver detoxify. You get liver stagnation or liver congestion. And how do you know that? Well, if you're a girl, you've got a muffin top. That's how you know that. If you're a man, you've got a beer belly. So if you've got a beer belly and you're a man, whether you drink beer, whether you don't drink beer, I don't care. That is an indication that your liver is congested. As your liver gets congested, it gets bigger and bigger. And so in a man, it's going to go this way. In women, it's going to go muffin top. And so nobody likes any of that. So I hate to bring that up. No shaming, anything like that. It's just look in the mirror. If you've got that, then you've got liver stagnation or congestion. If you've got liver congestion, then your lymph is not able to clean because that fluid goes through, just like your blood fluid, everything passes through the liver and it gets taken care of. So we need to make sure that we have all of that going in the right direction. Now, swelling and pain can go hand in hand. And so one of the things that you can do if you have swelling is you can use this brand new FDA device. It is called, in the United States, it is called a Renew Spa. In the rest of the world, it is called a wellness spa. Don't ask me why the change. That's above my pay grade. However, this little gizmo right here is good when you've got inflammatory processes going on in your body. So it depuffs the skin. It comes with this really neat conductive gel, right? It's not anything fancy. It's just conductive gel. These little knuckles, we call them knuckles. You might want to call them peanuts because they look kind of like peanuts. But there was about 7 to 8 years of research that went into this device because they wanted a device that would help you feel better. They wanted a massaging device. They wanted a device to depuff the skin. They wanted a device to relax the skin. And so they spent about 7 to 8 years in researching this. So what you do is you just put the conductive gel on these little knuckles, and then you go very slowly over the place that you're wanting to have some relief or some restoration or some relaxation, and it can actually depuff the skin. So what is puffed up skin? It is swollen skin. And so if you have swollen skin that you've got an inflammatory process. So this is something that you can have in your own home, all right? And so I have an injury that I have been working on, and I do use this to massage the skin, to relax the skin, to depuff the skin so that all the nutrients and all that kind of stuff can come in, not have any barriers to that, and it just makes you feel good. So if you have any of those kind of things, you might want to look at the Renew Spa, as it's called here in the United States. If you need help getting one, let me know, because we can definitely help you do that. And we want to help your body heal by combating the inflammatory process and not letting it go long term and become a chronic inflammatory process. So in a study, Mr. McGill, we talked about him a while ago, they thought that the body's initial pain, the body's initial swelling is part of the healing process. So they expanded their research on mice. They had some mice that had an injured paw. Now, I don't even want to know how these mice got this injured paw, okay? But anyway, they had these mice. Doesn't tell me how many, but they had these mice with the injured paw, and they were given either an over-the-counter inflammatory drug, anti-inflammatory drug, or they were given saline. So although the mice and the drug use initially showed fewer pain symptoms because their inflammation response was dulled, the pain eventually returned and became chronic. The mice that received saline, the pain subsided in half that time, and they remained pain-free. So pain is a warning thing for us. You are hurt. Don't do this activity, right? And we could all kind of understand that. If you are a professional sports player, college, or, professional, you hurt yourself, they're going to shoot you up with all these medications that dull your pain response, dull the inflammatory response, so you can play another day. Don't know that that's the wisest thing in the world, because when you do that, you further injure your body. And if you further injure your body, it's going to take longer to heal. So to see if this hypothesis was right, they tested humans. So the researchers did a separate analysis of patients in the UK. Those with acute back pain who reported taking anti-inflammatories were about 70% more likely to have pain 2 to 6 years later, an effect not seen in people who take acetaminophen or antidepressants. Now, just for the record, I am not a fan of acetaminophen and antidepressants. I'm just not a fan of that. If you need it, short term, then you do what's best for you. But long term, the acetaminophen kills your liver. It really, really works a number on your liver. So we're not talking about taking the odd pain pill once every 6 months, right? We're not talking about that. We're talking about taking maximum dosage 2, 3, 4 times a day over 4, 6, 8 months, right? We're talking about that. That really hurts your liver. Personally, antidepressants, one of the side effects of an antidepressant is it makes you more depressed. So I don't really know kind of what's going on with that. Again, I think most depression is a nutritional situation. You can have traumatic situations as well, the death of a spouse, the death of a child, all that kind of thing. That can lead to depression for sure. Most people don't have those kind of things. They have poor nutrition, they have poor absorption, which means their neurotransmitters in their brain are not working correctly. So think about it. Think about what your options are. Your options are to take an antidepressant, or your options are to exercise, or your options are to take a good vitamin, or your options are to work on your neural pathways to make sure that the neurotransmitters that you need are being produced. Where are they produced? They're produced in your gut. And so if your nutrition is bad, if your gut and your brain are not connected, then you're going to have issues with that. So just for the record, I'm not a fan of acetaminophen or antidepressants. Once in a while, okay, can't complain about that. Long-term, chronic term, we're not so happy about that. So while the researchers linked blocking early stage inflammation to development of chronic pain, decades of medical orthodoxy will not be overturned by a single study. So it's going to be a while before this comes out in a peer-reviewed study that's going to convince doctors to do something different. All right. So we need to be our own best advocate. We need to know this research. We need to be able to make the decisions that are best for our own body. Now, me, I broke my toe about 6 years ago, maybe. Lose track of time. Never have had a broken bone in my body, but I was over at my dad's house, and he's got a split level floor. And there's only about this much difference between going from the dining room into the laundry room, right? I guess I wasn't paying attention. I don't know. But when my left foot hit, these two toes stayed on the top level. The rest of my foot went on the bottom level, and this little toe broke. So I was on my way to the bathroom, came back. I'm hobbling a little bit, and I looked down at my toe, and my toe was at right angle. It's supposed to be like this. My toe was like this. And I looked at my daddy, and I said, I think I broke my toe. And he kind of shook his head and said, yeah, do you need me to fix it for you? I said, no, I'll do it. And one of the reasons I said I will do it is because I know what my pain tolerance is, and I'm going to know if it hurts or whatever. And so I just took my toe and popped it back into place, and it wasn't painful. And so I was, very thankful for that. Now, 2 to 3 hours later, after I got home, it was an evening, after I got home, took a bath, went to bed, the swelling and all of the acute inflammatory response was there, right? Because I broke a toe. So I'm unhappy. The covers hurt my toe. It's swollen. And so I hobble down to the kitchen and I get a pain reliever that is an all natural, organic pain reliever that has curcumin in it and other things. I'm not looking at the paper, so I couldn't tell you everything that it has in there. But I took 4 of those, and within 20 minutes, all of the throbbing had subsided, and I was able to go to sleep. And the next day, I took them as I needed for the pain, because nobody wants pain. Nobody wants pain whatsoever. But I also don't want to hurt my liver. And so I know that if I do something that is organic, that is good for me, not going to harm me, that I'm going to be better off in the long run. And so this is what people need to know. And this is why we do these videos, because if you have this information, then you can make the right choice. Now, if I had gone to the hospital because I have a broken toe, they're not going to do anything except what I did. They're going to pop it back into place. They may wrap it, but there's nothing that they can do. So I saved myself the journey. I saved myself the expense. I did everything at home. And when I had that acute inflammatory response, then I was able to deal with that with a holistic, organic anti-inflammatory that was not going to hurt my liver. Now, traditional Chinese medicine does work with natural substances for anti-inflammatories, and they have been doing this for acute inflammation for thousands of years. And so we want to look at ancient medicine. We want to see what they know that we don't know, because if we can learn from them, then we're able to handle ourselves a lot better. One of the things that they teach is gentle movement. Now, obviously, I broke my toe. I am not going to be doing any kind of exercise with my toe for a couple of weeks until it heals. That would just not be smart. But once it heals, you want to have that gentle manipulation, because you don't want it to get stiff and you don't want to have further inflammation down the road. And so you've got to have that gentle movement. The injury will respond better if it is flexible and you do gentle movement. Now, I'm not talking about being a gym rat. I'm not talking about, lifting 200 pounds or anything like that. I'm talking about gentle movement so that you don't get stuck. So I'm talking about stretching. I'm talking about just range of motion movement and that kind of thing. And that's something that the traditional Chinese people tell us. As we get that inflammation resolved, then the pain and the swelling will decrease, and you can continue with your gentle movement until you get to the place where you're not hurting anymore, and it's as if the inflammation had never happened. So what are the takeaways from this? The takeaways from this are, you do not want to have pain pills long term, because when you do, the studies show that it leads to chronic pain. Nobody wants chronic pain. When you're in chronic pain, that medication is not working, so you have to go to a stronger medication, so you have to go to stronger medication, so you have to go to stronger medication. We know that almost all pharmaceuticals are made from petroleum products, which the body was never ever designed to take. You were not designed for that. That's not the fuel that we're supposed to put in our body. So if we can do something holistic, if we can do something to restore our health, then we're not going to be dependent on that, and nobody wants to be in chronic pain. I have been in chronic pain in my life. Don't like it. Don't want to return there. Don't want you taking these anti-inflammatories to resolve a short-term issue, but you take them too long, and so you get yourself into that chronic pain. And we've got this little device, the Renew Spa, that you can use at home for those conditions, massaging the skin, depuffing the skin, restoring the skin, relaxing the skin, so that your body's able to heal a whole lot faster and you feel better. So a lot of takeaways today. It is the weekend. What do we do at the weekend? It's a long weekend here in the United States. It is Memorial Day weekend. So that means we've got an extra day to relax and recover and do all the things that we need to do. We will be closed on Memorial Day just to honor our fallen veterans and that kind of thing. So I hope you'll do something to honor all that they did for us so that we can have the freedoms that we do have. So you take care. It is the weekend. Relax, recover, refresh, restore, and I will see you next week.